1. What is the first sign of pregnancy visible on ultrasound? आप लोग खुद से आंसर देने का कोशिश कीजिएगा. Here correct option is option B, gestational sac. Question number 2. Which hormone is primarily responsible for maintaining pregnancy? यहाँ पे बोल रहा है कौन सा हार्मोन है जो प्रेगनेंसी को मेंटेन करने में हेल्प करता है. ये बहुत इजी क्वेश्चन है, ये आप लोगों को आना चाहिए. यहाँ पे करेक्ट ऑप्शन होगा ऑप्शन सी, प्रोजेस्टेरॉन. क्वेश्चन नंबर 3. व्हेन डज द फीटल हार्ट स्टार्ट बीटिंग? Here correct option is option D, 5th week. Question number 4. What is the normal duration of puerperium? Here correct option is option B, 6 weeks. Question number 5. Why is folic acid important in early pregnancy? आप लोग डॉक्टर के पास जाते हैं, दैट मीन्स प्रेगनेंसी लेडी लोग, तो फॉलिक एसिड टैबलेट जो होता है डॉक्टर मस्ट प्रोवाइड करता ही है. वो क्यों करता है? आप लोगों को पता होना चाहिए कि फॉलिक एसिड जो होता है वो न्यूरल ट्यूब डिफेक्ट को प्रिवेंट करता है, इसीलिए दिया जाता है. तो हियर करेक्ट ऑप्शन इज ऑप्शन सी, टू प्रिवेंट न्यूरल ट्यूब डिफेक्ट. Question number 6. Which sign is considered a probable sign of pregnancy? Here correct option is option A, Chadwick's sign. Question number 7. When is Rh immunoglobulin given to an Rh negative mother? Here correct option is option C, at 28 weeks and after delivery. Question number 8. Where is most common site of fertilization? ये बहुत इंपॉर्टेंट क्वेश्चन है और बहुत इजी भी है, ये सबको पता होता है. ये करेक्ट ऑप्शन होगा यहाँ पे ऑप्शन सी, एम्पुला ऑफ फैलोपियन ट्यूब. सबको पता होता है जो फैलोपियन ट्यूब का जो एम्पुला एक पार्ट है फैलोपियन ट्यूब का, वहीं पे फर्टिलाइजेशन होती है ओवम एंड स्पर्म का. Question number 9. What is the primary goal of antenatal care? Here correct option is option C, safe mother and healthy baby. Question number 10. Which instrument is used to measure fundal height? फंडल हाइट को मेजर करने के लिए कौन सा इंस्ट्रूमेंट यूज करता है? Here correct option is option C, tape measure. Question number 11. When is the best time to check fetal movement daily? Here correct option is option C, after meals. Question number 12. Why is iron supplement important during pregnancy? Here correct option is option B, to prevent anemia. Question number 13. What is the main purpose of Leopold's maneuvers? Here correct option is option C, determine fetal lie and presentation. Question number 14. Which method is used for cervical assessment in labor? Here correct option is option B, vaginal examination. Question number 15. Who discovered the Apgar score? Here correct option is option B, Virginia Apgar. Question number 16. What does the term station in labor refer to? Here correct option is option C, fetal descent. Question number 17. When should breastfeeding be initiated after normal delivery? Here correct option is option D, within 1 hour. Question number 18. Why is skin to skin contact important after birth? Here correct option is option B, for thermal regulation and bonding. Question number 19. When color of lochia indicates normal healing in the first few days postpartum? Here correct option is option C, red color. Question number 20. what is the normal duration of each uterine contraction in active labor? Here correct option is option C, 30 to 60 seconds. Question number 21. When is the ideal time to perform the first ultrasound in pregnancy? Here correct option is option B, 6 to 8 weeks. Question number 22. Which parameter is best for estimating gestational age in early pregnancy? Here correct option is option B, crown ramp length. Question number 23. What is the term for softening of the cervix in pregnancy? Here correct option is option B, Goodell's sign. Question number 24. Where is the fundus located at 20 weeks of pregnancy? Here correct option is option C, at umbilicus. Question number 25. Why is tetanus toxoid given during pregnancy? Here correct option is option B, prevent neonatal tetanus. Question number 26. Which condition is an absolute contraindication for vaginal delivery? Here correct option is option A, cephalopelvic disproportion. Question number 27. What is the name of the hormone that promotes breast milk production? Here correct option is option C, prolactin. Question number 28. When is the best time to assess for postpartum hemorrhage risk? Here correct option is option C, immediately after placenta delivery. Question number 29. Which maneuver is used to prevent perineal tear during delivery? Here correct option is option A, Wright's maneuver. Question number 30. Why is early initiation of breastfeeding encouraged? Here correct option is option C, stimulates oxytocin and bonding. Question number 31. When is fundus expected to be at the level of umbilicus postpartum? Here correct option is option C, 24 hours. Question number 32. What is the normal volume of amniotic fluid at term? Here correct option is option C, 800 to 1000 ml. Question number 33. Which fetal presentation is most favorable for normal vaginal delivery? Here correct option is option C, vertex presentation. Question number 34. Where should vitamin K injection be given to a newborn? Here correct option is option C, intramuscular thigh. Question number 35. What is the most common cause of postpartum hemorrhage? Here correct option is option B, uterine atony. Question number 36. When should the first postnatal visit ideally occur? Here correct option is option B, within 7 days. Question number 37. Which maternal position increases uteroplacental circulation? Here correct option is option B, left lateral position. Question number 38. What is the most reliable method to confirm pregnancy in the first trimester? Here correct option is option C, ultrasound. Question number 39. What is the best method to assess fetal well-being in late pregnancy? Here correct option is option C, non-stress test. Question number 40. Which WH factor contribute most to maternal mortality in India? Here correct option is WHO, who is attending delivery. What does Apgar score assist? Apgar score কেন চেক করা হয়? Here correct option is option C, newborn condition. Newborn এর condition চেক করার জন্য Apgar score দেখা হয়। Question number 42. Which layer of placenta is fetal in origin? Here correct option is option A, chorion. Question number 43. What is the role of oxytocin after delivery? Here correct option is option C, contracts uterus. Question number 44. Which vaccine is contraindicated in pregnancy? Here correct option is option C, rubella. Question number 45. When does embryo become a fetus? Here correct option is option B, after 8 weeks. Question number 46. What is the function of amniotic fluid? Here correct option is option B, protects fetus. Question number 47. Which method is ideal for contraception during lactation? Here correct option is option C, progesterone only pills. Question number 48. Where does placental exchange of gases take place? Here correct option is option C, intervillous space. Question number 49. Why are pregnant women more prone to UTIs? Here correct option is option B, progesterone induced smooth muscle relaxation. Question number 50. What is the recommended weight gain during pregnancy for a normal BMI woman? Here correct option is option C, 11 to 16 kg. Question number 51. When is perinatal period defined to start? Here correct option is option B, from 28 weeks gestation. Question number 53. What is the risk of smoking during pregnancy? Here correct option is option A, low birth weight. Question number 54. What does station 0 indicate in labor? Here correct option is option B, head and ischial spine. Question number 55. Which hormone initiates labor? Here correct option is option C, oxytocin. Question number 56. Where is the best site to palpate uterine contractions? Here correct option is option C, fundus. Question number 57. When does lochia typically stop? Here correct option is option D, 6 weeks. Question number 58. What is the first vaccine given to a newborn? Here correct option is option C, BCG. Question number 59. Why is colostrum important for newborns? Here correct option is option C, rich in antibiotics. Question number 60. What does uterine involution means? Here correct option is option B, shrinking of uterus. Question number 61. What is the typical duration of the puerperium period? Here correct option is option C, 6 weeks. Question number 62. Which position is preferred during delivery to reduce perineal trauma? Here correct option is option B, left lateral. Question number 63. What is the function of the placenta? Here correct option is option C, gas and nutrient exchange between mother and fetus. Question number 64. When should iron and folic acid supplementation start during pregnancy? Here correct option is option B, as soon as pregnancy is confirmed. Question number 65. What does a non-stress test measure? Here correct option is option C, fetal heart rate and movements. Question number 66. Which vitamin help prevent neural tube defects? Here correct option is option B, folic acid. Question number 67. What is the best method to detect fetal anomalies early in pregnancy? Here correct option is option A, amniocentesis. Question number 68. Why is RH incompatibility dangerous during pregnancy? Here correct option is option C, causes hemolytic disease of the newborn. Question number 69. Which hormone maintain pregnancy in the early weeks? Here correct option is HCG hormone. Question number 70. What causes morning sickness in early pregnancy? Here correct option is option C, HCG hormone, that means human chorionic gonadotropin hormone. Question number 71. What is the most effective way to prevent maternal tetanus? Here correct option is option C, tetanus toxoid vaccination. Question number 72. When is engagement of the fetal head expected in primigravida? Here correct option is option B, before labor. Question number 63. What is the normal fetal heart rate? Here correct option is option C, 110 to 160 beats per minute. Question number 74. Why is fundal height measured during pregnancy? Here correct option is option B, to estimate fetal growth and gestational age. Question number 75. Which test is commonly used to confirm rupture of membranes? Here correct option is option B, nitrazine test. Question number 76. What is the first sign of true labor? Here correct option is option D, regular painful contraction. Question number 77. When is episiotomy usually performed? Here correct option is option C, during delivery of the head. Question number 76. What is the purpose of Leopold's maneuver? Here correct option is option C, to determine fetal position and presentation. Question number 79. Which condition leads to a snowstorm appearance on ultrasound? Here correct option is option C, molar pregnancy. Question number 80. What is the most common presentation of the fetus? Here correct option is option D, vertex presentation. Next আরো 20টি কোশ্চেন আমি কালকে আপলোড করব। ওকে গাইজ, বাই, দেখা হচ্ছে পরের ভিডিওতে। Hey everyone, welcome my YouTube channel. তো আজকে আমি পড়াবো সাইকিয়াট্রিক অফ নার্সিং, দ্যাট মিন্স মেন্টাল হেলথ নার্সিং। ঠিক আছে, 40টা ইম্পর্টেন্ট কোশ্চেন আমি আপনাদের সাথে আজকে শেয়ার করব। তাহলে চলো স্টার্ট করি কোশ্চেন নাম্বার 1 থেকে। ভেরি ইম্পর্টেন্ট কোশ্চেন, ভালো করে দেখবে। টপ 40 কোশ্চেনের মধ্যে এইসব আসে, ঠিক আছে, অ্যান্ড ভেরি রিপিটেড কোশ্চেন, ঠিক আছে, অনেকবার পরীক্ষা এগুলো জিজ্ঞেস করা হয়। তাহলে চলো স্টার্ট করি কোশ্চেন নাম্বার 1 থেকে। Which is the most common symptom of depression? আপনারা নিজে থেকেও কোশ্চেনের অ্যান্সার দেওয়ার চেষ্টা করবেন। তাহলে এখানে কারেক্ট অপশন ইজ অপশন সি, লো মুড। Question number 2. Which drug is used as mood stabilizer in bipolar disorder? Here correct option is option B, lithium. Question number 3. What is the term for false sensory perception? Here correct option is hallucination. যদি কোশ্চেনে জিজ্ঞাসা করে ফলস সেন্সরি পারসেপশন কাকে বলে, তাহলে বলবা হ্যালুসিনেশন, অ্যান্ড যদি বলে ফলস বিলিভ তাহলে বলবে ডিলিউশন, ঠিক আছে। কোশ্চেন নাম্বার 4. Which is an example of thought disorder? Here correct option is all of above. Question number 5. What is ECT mainly used for? ECT এর ফুল ফর্ম হয় ইলেকট্রোকনভালসিভ থেরাপি। কখন ইউজ করা হয়? যখন সিভিয়ার ডিপ্রেশন হয়। ঠিক আছে। Question number 6. Who is the father of psychoanalysis? This is a very important question. যে father of psychoanalysis কে? তো এখানে কোশ্চেনের অ্যান্সার হবে অপশন এ, ফ্রয়েড। Sigmund Freud is father of psychoanalysis. Question number 7. Which phobia is fear of closed spaces? Here correct option is option C, claustrophobia. Question number 8. Which is an antipsychotic drug? Antipsychotic drug holo option B, chloropromazine. Question number 10. Which therapy help with phobias? Here correct option is option B, systematic desensitization. Question number 12. Which is the best approach for suicidal patient? Here correct option is option C, constant observation. Question number 13. What is psychosis? Correct option is option B, reality loss. Question number 14. Who developed hierarchy of needs? Correct option is option B, Maslow. Question number 15. Which is an example of neurosis? Here correct option is option C, phobia. Question number 16. What is mutism? Here correct option is option B, no speech. Question number 17. What is flight of ideas? Here correct option is option C, rapid shifting of ideas. Question number 18. What is obsession treated with? Here correct option is option C, antidepressants and CBT. Question number 19. Which neurotransmitter is low in depression? Here correct option is option B, serotonin. Question number 20. What is the fear of open spaces? Here correct option is option B, agoraphobia. মনে রাখবে fear of open spaces is agoraphobia and fear of closed spaces is called claustrophobia. Question number 21. Which is the side effect of antipsychotics? Here correct option is option C, extrapyramidal symptoms. Question number 22. Which therapy uses rewards and punishment? Here correct option is option C, behavior therapy. Question number 23. Which is true about dementia? Here correct option is option C, progressive memory loss. Question number 25. Which vitamin deficiency is vernix? Here correct option is option B, B1. Question number 27. Which is a manic symptom? Here correct option is option B, insomnia. Question number 28. Which test checks dementia? Here correct option is option C, mini mental state examination. देखो डिमेंशिया का मतलब है मेमोरी लॉस, डिमेंशियार माने হচ্ছে মেমোরি লস। ঠিক আছে, তো অবভিয়াসলি মেমোরি লস হলে কোনটা চেক করা উচিত? তো মিনি মেন্টাল টেস্ট এক্সামিনেশন। 29. Question number 29. Which term means false fixed belief? False fixed belief হচ্ছে delusion. Question number 30. Which sign is seen in catatonia? Here correct option is all of the above. Question number 31. What is অ্যাক্রোফোবিয়া। কোশ্চেনের অ্যান্সারগুলি নিজে থেকেও দেওয়ার চেষ্টা করবে, পজ করে করে কোশ্চেনের অ্যান্সারগুলি দিবে, ঠিক আছে? তারপরে কোশ্চেনের অ্যান্সারটি শুনে নেবে। অ্যাক্রোফোবিয়া মিন্স ফিয়ার অফ হাইট, অপশন সি ইজ কারেক্ট। Question number 32. What is delusion of grandeur? Here correct option is option B, feeling powerful. দেখো delusion of grandeur ও কোশ্চেনে জিজ্ঞাসা করতে পারে, না হলে delusion of grandicity-ও জিজ্ঞাসা করতে পারে। যে কোনো যেটাই জিজ্ঞাসা করবে আপনারা বলবেন feeling powerful। এর কারেক্ট অপশন হবে অপশন বি। Question number 33. What is anhedonia? Here correct option is loss of pleasure. Question number 34. What is ADHD? Here correct option is option C, hyperactivity and poor focus. Question number 35. What is confabulation? Here correct option is option B, memory filling with false stories. Question number 36. Which therapy is for schizophrenia? Here correct option is option D, supportive psychotherapy. Question number 37. First antipsychotic discover মানে প্রথম অ্যান্টিসাইকোটিক ড্রাগ কোনটি ডিসকভার করা হয়েছিল? Here correct option is option A, chlorpromazine. Question number 38. Which is best treatment for panic attack? Here correct option is option B, benzodiazepine. Question number 39. Token economy is used for. Here correct option is, এই কোশ্চেনের অ্যান্সারটি আপনারা কমেন্ট বক্সে দেওয়ার চেষ্টা করো। ভেরি ইজি কোয়েশ্চেন। টোকেন ইকোনমি ইজ ইউজড ফর মানে কোনটা মেন্টাল ডিজিজে দেওয়া হয়? ডিপ্রেশনে, না স্কিজোফ্রেনিয়া, না ফোবিয়া, या ডিমেনসিয়া? Question number 40. What is kleptomania? Here correct option is option A, stealing. Hey everyone, good morning, welcome my YouTube channel. तो चलो स्टार्ट करते हैं क्वेश्चन नंबर 1 से। Which educational strategy focus on collaborative learning among nursing student? Here correct option is option C, group projects. Question number 2. The foundation of nursing education is based on. Here correct option is option C, both. That means theory and practice. Question number 3. What is the primary role of a nursing instructor? Here correct option is option B, teachers. Question number 4. Which term based describe learning that combine classroom and clinical practices? Here correct option is option B, blended. Question number 5. Simulation lab in nursing are primarily used for. Here correct option is option B, practice. Question number 6. The purpose of reflection in nursing education is to. Here correct option is option B, self-evaluate. Question number 7. A key component of evidence-based practice in nursing is. Here correct option is option B, best research evidence. Question number 8. In nursing, preceptorship refers to. Here correct option is option C, on the job training. Question number 9. What type of learning focuses on small group discussion to solve cases? Here correct option is option A, problem based. Question number 10. Which skill is essential in patient-centered care? Here correct option is option B, communication. Question number 11. Which approach is commonly used in nursing for clinical decision making? Here correct option is option B, evidence based. Question number 12. What is the main purpose of clinical assessment in nursing? Here correct option is option A, evaluating performance. Question number 13. Which tool aids in monitoring nursing student clinical progress? Here correct option is option A, checklist. Question number 14. The goal of interprofessional education in nursing is to. Here correct option is option B, promote teamwork. Question number 15. What type of nursing program prepares graduate for a broader scope of practice? Here correct option is option B, bachelor's degree. Question number 16. Which is primary focus in community health nursing education? Here correct option is option B, preventive care. Question number 17. In nursing education, ethical practice is mainly tough through. Here correct option is option A, case studies. Question number 18. In nursing education, critical thinking is essential for. Here correct option is option A, clinical decision making. Question number 19. Which method is used to improve nurses' interpersonal skill with patient? Here correct option is option A, simulation exercise. Question number 20. The focus of health promotion in nursing is to. Here correct option is option A, prevent disease. Question number 21. What is the main role of mentor in nursing education? Here correct option is option C, providing guidance. Question number 22. What type of learning is used in nursing to simulate real life emergencies? Here correct option is option C, group discussion. Question number 23. The nursing process included assessment, diagnosis, planning, interventions and. Here correct option is option B, evaluation. Question number 24. Which learning technique is especially useful in critical care nursing education? Here correct option is option B, case study analysis. Question number 25. In nursing education, the term scope of practice refers to. Here correct option is option A, legal boundaries. Question number 26. What is the primary focus of pharmacology in nursing education? Here correct option is option A, medication administration. Question number 27. In nursing education, SBAR is communication tool used for. Here correct option is option B, shift handoff. Question number 28. Which method is often used to evaluate critical thinking in nursing students? Here correct option is option A, case studies. Question number 29. In nursing education, debriefing after a simulation is used to. Here correct option is option B, reflect on performance. কোশ্চেন নাম্বার 30 অ্যান্ড দিস ইজ দ্য লাস্ট কোশ্চেন। এই কোশ্চেনটির অ্যান্সার আপনারা নিচে কমেন্ট বক্সে দেওয়ার চেষ্টা করো। ভেরি ইজি কোশ্চেন। উইচ টাইপ অফ কোশ্চেন ইজ কমনলি ইউজ টু টেস্ট নলেজ অ্যাপ্লিকেশন ইন নার্সিং এক্সাম। এখানে বলা হয়েছে নার্সিং এক্সামে কোন টাইপের কোশ্চেন জিজ্ঞাসা করা হয় একজন নার্সের নলেজ চেক করার জন্য। তো এখানে অপশন নাম্বার এতে আছে ট্রু অর ফলস। ট্রু অর ফলস টাইপের কোশ্চেন জিজ্ঞাসা করা হয়, না ফিল ইন দ্য ব্ল্যাঙ্কস কোশ্চেন জিজ্ঞাসা করা হয়, না সিনারিও বেসড কোশ্চেন জিজ্ঞাসা করা হয়, না এসে কোশ্চেন জিজ্ঞাসা করা হয়। তোমরা কোশ্চেনের অ্যান্সারটি নিজে থেকে দেওয়ার চেষ্টা করো। দিস ইজ এ ভেরি ইজি কোশ্চেন, আর এই টাইপের কোশ্চেনই পরীক্ষায় সব থেকে বেশি জিজ্ঞাসা করা হয় নার্সিং এডুকেশন থেকে। ঠিক আছে, তো ওকে গাইজ, বাই বাই, দেখা হচ্ছে পরের ভিডিওতে। Hey everyone, welcome Top 100 Question Series. Let's start. Question number 1. Which artery is most commonly blocked in myocardial infarction? Here, correct option is option B, left anterior descending artery. Question number 2 is, what is the first line drug for eclampsia seizure prevention? Here, correct option is option C, magnesium sulfate. Question number 3 is, which hormone regulate water balance in the body? Here, correct option is ADH, that means vasopressin hormone. Question number 4, what condition result from overproduction of growth hormone in adults? Here, correct option is option C, acromegaly. Question number 5, which electrolyte imbalance causes trousseaucine? Here, correct option is option B, hypocalcemia. Question number 6 is, when is the hepatitis B vaccine first given to a newborn? Here, correct option is option B, within 24 hours of birth. Question number 7 is, what is the most sensitive cardiac marker of MI, that means myocardial infarction? Here, correct option is option C, troponin I. Question number 8 is, which vitamin is given to prevent hemorrhagic disease in newborns? Here, correct option is option B, vitamin K. Question number 9 is, which drug causes gingival hyperplasia as a side effect? Here, right option is option A, phenytoin. Question number 10, what is the hallmark of nephrotic syndrome? Here, correct option is option B, proteinuria. Question number 11 is, which bacteria is responsible for rheumatic fever? Here, correct option is option B, Streptococcus pyogenes. Question number 12, when is Rh immunoglobulin given to Rh negative mother? Here, correct option is option C, at 28 weeks and within 72 hours post-delivery. Question number 13, what position help relieve umbilical cord prolapse? Here, correct option is option C, knee chest position. Question number 14, which vitamin is essential for calcium absorption? Here, correct option is option B, vitamin D. Question number 15, which drug is contraindicated in pregnancy due to tetrogenicity? Here, correct option is option A, methotrexate. Question number 16, which hormone stimulate milk ejection? Here, correct option is option C, oxytocin. Question number 17 is, what is the function of surfactant in lungs? Here, correct option is option C, reduce surface tension. Question number 18. What causes crackles in lungs on auscultation? Here correct option is option C, pulmonary edema. Question number 19. What is the hallmark features of left-sided heart failure? Here correct option is option C, pulmonary congestion. Question number 20. What is the major complication of thrombocytopenia? Here correct option is option C, bleeding. Question number 21. Which reflex is stimulated by stroking a newborn chick? Here correct option is option B, routine check. Question number 22. Which nutrient deficiency causes neural tube defects? Here correct option is option C, folic acid. Question number 23. Which medication causes optic neuritis as a side effect? Here correct option is option C, ethambutol. Question number 24. What is the immediate management for status epilepticus? Here correct option is option A, diazepam IV. Question number 25. Which insulin has the fastest onset? Here correct option is lisproinsulin. Question number 26. What test confirm latent tuberculosis infections? Here correct option is option A, Mantoux test. Question number 27. Which cranial nerve control facial expression? Here correct option is option B, cranial nerve 7. Do you know the name of cranial nerve 7? This is a facial nerve. Okay, let's go next question. Question number 28. What is the most common site of DVT in lower limb? Here correct option is option B, femoral vein. Question number 29. Which vaccine is live attenuated? Here correct option is option C, MMR, that means measles, mumps, rubella. Question number 30. Which cranial nerve is tested by corneal reflex? Here correct option is option B, cranial nerve 5 and 7. Question number 31. Which electrolyte imbalance is most likely in diabetic ketoacidosis, DKA? Here correct option is option B, hyperkalemia. Question number 32. What is the classic sign of increased intracranial pressure? Here correct option is option A, bradycardia. Question number 33. Which phase of labor is the most painful? Here correct option is transition phase. Question number 34. Which organism is the most common cause of UTI in females? Here correct option is option C, E. coli. Question number 35. What is the antidote for heparin overdose? Here correct option is option B, protamine sulfate. Question number 36. Which diagnostic test confirm appendicitis? Here correct option is option B, CT seen abdomen, that means CT scans abdomen. Question number 37. Which neurotransmitter is deficient in Parkinson's disease? Here correct option is option B, dopamine. Question number 38. What is the best position for a patient in shock? Here correct option is option C, Trendelenburg position. Question number 39. Which blood group is universal donor? This is a very easy question. Here correct option is option C, O negative. Question number 40. Which part of the brain control temperature regulation? Here correct option is option B, hypothalamus. Question number 41. What is the gold standard test for tuberculosis diagnosis? Here correct option is option C, sputum AFB culture. Question number 42. Which condition presents with moon face and buffalo hump? Here correct option is option B, Cushing syndrome. Question number 43. What is the normal range of INR for patient on warfarin? Here correct option is option C, 2.0 to 3.0. Question number 44. Which condition is characterized by high blood sugar during pregnancy? Here correct option is option C, gestational diabetes. Question number 45. What is the antidote for acetaminophen overdose? Here correct option is option B, acetylcysteine. Question number 46. Which nutrient deficiency causes scurvy? Here correct option is option B, vitamin C. Question number 47. Which fetal presentation is most favorable for normal delivery? Here correct option is option C, cephalic presentation. Question number 48. What is the expected weight of a baby at 1 year? Here correct option is option B, triple birth weight. Question number 49. What is the causative agent of tetanus? Here correct option is option B, Clostridium tetani. Question number 50. Which organ is affected in glomerulonephritis? Here correct option is option B, kidney. Question number 51. What is the normal respiratory rate? Here correct option is 30 to 60. That means this is a normal respiratory rate in a newborn. Question number 52. What condition present with cherry red spot in macula? Here correct option is option C, Tay-Sachs disease. Question number 53. Which test is used for HIV confirmation? Here correct option is option C, Western blot. Question number 54. What type of immunity is conferred by vaccines? Here correct option is option C, artificial active. Question number 55. What is the cause of kwashiorkor? Here correct option is option A, protein deficiency. Question number 56. Which condition is indicated by a positive Phalen test? Here correct option is option B, carpal tunnel syndrome. Question number 57. What is the priority action in anaphylactic shock? Here correct option is option C, administer epinephrine. Question number 58. Which antihypertensive is contraindicated in pregnancy? Here correct option is option C, ACE inhibitors. Question number 59. What is the most common cause of postpartum hemorrhage? Here correct option is এর কারেক্ট অ্যান্সারটা আপনারা দেওয়ার চেষ্টা করুন। সবাই জানে পোস্টপার্টাম হেমারেজের কমন কোজ কোনটি, ঠিক আছে? অপশন এ তে আছে রিটেইনড প্লাজেন্টা, অপশন বি তে আছে ইউটেরাইন রাপচার, অপশন সি তে আছে ইউটেরাইন অ্যাটর্নি, অপশন ডি তে আছে সার্ভাইকাল টিয়ার। তো কারেক্ট অ্যান্সারটি আপনারা নিজে থেকে দেওয়ার চেষ্টা করুন। দেন কোশ্চেন নাম্বার 60. হোয়াট ইজ দ্য আর্লিয়েস্ট সাইন অফ হাইপোভলিমিক শক? Here correct option is option C, tachycardia. Question number 61. Which condition causes a butterfly rash on face? Here, correct option is option B, SLE. Question number 62. What is the purpose of ringers lactate in burns? মানে RL সেলাইন কোনটি পারপাসের জন্য দেওয়া হয় বার্ন পেশেন্টকে? Here, correct option is option C, fluid resuscitation. Question number 63. What is the best site for IM injection in infant? Here, correct option is option C, vastus lateralis. Question number 64. What is the primary symptom of meningitis? Here, correct option is option B, neck stiffness. Question number 65. What condition is associated with Beans joint protein in urine? Here, correct option is option A, multiple myeloma. Question number 66. Which test is done to confirm DVT? তোমরা কি জানো DVT এর ফুল ফর্ম কি? DVT এর ফুল ফর্ম হচ্ছে deep vein thrombosis. Here, correct option is option A, Doppler ultrasound. Question number 67. Which cell produce insulin? Here, correct option is option B, delta cells. Question number 68. Which hormone is responsible for uterine contraction? Here, correct option is option C, oxytocin. Question number 69. What is the common complication of mumps? Here, correct option is option A, orchitis. Question number 70. Which technique is used to assist fetal well-being in third trimester? Here, correct option is option B, non-stress test. Question number 71. Which condition result from folate deficiency during pregnancy? Here, correct option is option A, anencephaly. Question number 72. Which vitamin prevent night blindness? Here, correct option is option A, vitamin A. Question number 73. What condition is suspected with a positive Murphy's sign? Here, correct option is option B, cholecystitis. Question number 74. What is the earliest sign of dehydration in infants? Here, correct option is option A, sunken fontanelles. Question number 75. Which vaccine is contraindicated in immunocompromised child? Here, correct option is option B, MMR. Question number 76. What condition result from deficiency of intrinsic factor? Here, correct option is option B, pernicious anemia. Question number 77. Which lab value is elevated in pancreatitis? Here, correct option is option A, lipase. Question number 78. What is the function of erythropoietin? Here, correct option is option C, stimulate RBC production. Question number 79. Which medication is used for absence seizures? Here, correct option is option C, valproic acid. Question number 80. What is expected Apgar score for normal newborn at 1 minute? Here, correct option is option C, 7 to 10. Question number 81. Which drug is the first line treatment for status epilepticus? Here, correct option is option B, diazepam. Question number 82. What is the hallmark symptom of nephrotic syndrome? Here, correct option is option B, proteinuria. Question number 83. Which gland regulate metabolism in the human body? Here, correct option is option B, thyroid gland. Question number 84. What condition is indicated by a positive Babinski reflex in adults? Here correct option is option D, upper motor neuron lesion. Question number 85. Which test is used to assist blood clotting in heparin therapy? Here correct option is option C, aptitude. Question number 86. What is the priority nursing action during a blood transfusion reaction? Here correct option is option C, stop the transfusion. Question number 87. Which vitamin enhance iron absorption in the intestine? Here correct option is option B, vitamin C. Question number 88. What is the primary route of HIV transmission? Here correct option is option C, sexual contact. Question number 89. Which bacteria is the most common cause of peptic ulcers? Here correct option is option C, Helicobacter, that means H. pylorus. Question number 90. What is the preferred site for subcutaneous heparin injection? Here correct option is option C, abdomen. Question number 91. Which hormone control blood calcium levels? Here correct option is parathyroid hormone, option number C. Question number 92. Which test is done before initiating warfarin therapy? Here correct option is PT by INR. Question number 93. Which condition causes reddish urine without RBCs? Here correct option is option B, myoglobinuria. Question number 94. What is the gold standard test for myocardial infarction? Here correct option is option A, troponin I. Question number 95. Which fetal position lead to prolonged labor? Here correct option is option B, occiput posterior. Question number 96. What is the normal blood urea nitrogen range? Here correct option is option B, 8 to 20 mg per deciliter. Question number 97. Which medication is used to prevent postpartum hemorrhage? Here correct option is option A, misoprostol. Question number 98. What is the first nursing action during a seizure? Here correct option is option C, turn patient to side. Question number 99. Which lab value indicate kidney function? Here correct option is option C, creatinine. Question number 100. Which technique is best for pain relief during labor? Here correct option is option B, controlled breathing. হেই এভরিওয়ান, আমি প্রত্যেকদিন আপনাদের জন্য 100টি কোশ্চেনের সিরিজ নিয়ে আসবো, ঠিক আছে? অ্যান্ড এই 100টি কোশ্চেনের মধ্যে আপনারা কত নাম্বার পাচ্ছেন, মানে 100টি কোশ্চেনের মধ্যে কয়টা আপনারা রাইট করছেন অ্যান্ড কয়টা কোশ্চেন অ্যান্সার আপনারা রং করছেন, এটা আমার কমেন্ট সেকশনে একদম জানিয়ে যাবেন। আমিও দেখতে চাই যে কার জন্য এই কোশ্চেন প্যাটার্ন ইজি অ্যান্ড কার জন্য মডারেট অ্যান্ড কার জন্য হার্ড। ওকে গাইজ, বাই বাই, দেখা হচ্ছে পরের ভিডিওতে।